Hi, Ms. Fernandez.
Hi.
Good to see you again. How are you feeling?
I'm okay. How are you?
I'm good. So I know you were having some palpitations last time.
Yeah.
We ordered a Holter monitor and an echo for you. Luckily, both of them came back completely normal.
Really?
Which is great. But are you still having the palpitations?
Yeah, like 2 or 3 times a day. I'm still getting them.
Okay, are they worse or better or the same as before?
They're the same.
Okay.
Yeah.
And what do they feel like?
Just my heart's beating fast.
Okay. Do you have any chest pain or shortness of breath when you have
No.
these palpitations?
No.
Are the palpitations worse when you're exercising?
Not particularly, but I live a pretty chill lifestyle.
Okay, they just at rest.
It's like I notice it when I'm at work. Like
Okay.
it'll just start beating quickly.
Okay.
And it's just weird. It just concerns me just because, like, my grandma has AFib.
Okay. And they still only last for about a minute at a time.
Yeah, less than that, I would say.
And does anything make them better? Just relaxing or?
Yeah,
deep breathing?
I just try to relax. I take a second, just breathe.
Okay. Have you been increasing your exercise like we talked about last time?
I'm trying to bike to work instead of Uber to work.
Okay. Well, that's good. That's a start.
Yeah.
So we'll just keep working on that. Luckily, I know you said your grandmother had AFib, but your Holter monitor is completely normal. Your echo is completely normal. So more than likely, these are just kind of a benign thing that you'll feel every once in a while. You did have symptoms while you were wearing the monitor, right?
Yeah, I did.
Okay. Yeah, we saw a normal rhythm throughout the whole 2 weeks that you wore it.
Oh wow. Okay. All right.
Which is a little weird, but it's
Yeah.
it's good from a cardiac standpoint.
Yeah, as long as when should I be worried?
I think time to worry would be if you had a lot of shortness of breath, if you had any chest pain. You haven't had any passing out episodes or lightheadedness.
No.
Yeah, so if you pass out, those are things that would be more worrisome, and I'd like you to go to the ER if you have any symptoms like that.
Okay, I will. I definitely will.
Okay, sounds good. Do you mind if I take a listen?
Yeah, sure. Go ahead.
Okay. Just breathe normal. This heart sounds at regular rate and rhythm right now. Take a listen to your lungs. Deep breath. Okay. Alright. Lungs are clear to auscultation bilaterally. Check your pulse here. It's a little higher. Are you nervous at the doctor?
Yeah.
Okay. Don't be afraid.
I was really scared of my results, but I'm glad that they're normal.
Well, they're normal. Could I have you lean back for me? You haven't noticed any ankle swelling? Anything like that? Okay. No pitting edema? You don't have any belly pain?
No.
Anything like that?
No.
Okay. Abdomen's non-tender, non-extended.
Okay.
So I think everything looks normal from a cardiology standpoint. If you'd like, I can see you back in a year just to kind of check on things, and feel more than welcome to call my office if you want to come in before that, if you have any new or worsening symptoms.
Okay.
But really, since those tests we did were normal, I don't think we need to start you on any medications.
Okay.
Or anything like that. Do you have any questions for me?
No. I'm just glad my results were normal. That's great.
Okay.
Thank you.
Yeah. Well, like I said, from a cardiac standpoint, I think you're doing great.
Okay.
So just keep making those lifestyle changes, increasing your exercise.
I will. I love riding my bike.
That's good to know.
Saving a ton of money, not Ubering.
And as long as you don't have anything else come up, I'll see you back in a year.
All right. Okay. It was nice seeing you.
It was good seeing you.